If you have tried everything for your sciatica or disc herniation pain, whether it's physical therapy, chiropractic, exercises, or even injections, and nothing has made a real difference, I want you to know you are not out of options. Now, many people start to believe surgery is the next and only step, but that is usually because no one has ever taken the time to clearly explain or possibly even brought up the topic of non-surgical spinal decompression. Now, this therapy has helped tens of thousands of disc herniation or sciatic patients, yet most people still do not understand what it actually does. Now, here's research that supports its potential. A 2022 study published in the International Journal of Clinical Practice found that patients with lumbar disc herniations who received non-surgical spinal decompression had significantly greater improvements compared to a control group who received a non-force pseudo treatment. Their leg pain dropped more, their function improved more, and their disc bulge shrank by about 27% on average compared to about 7% in the control group. Now, this shows that non-surgical spinal decompression can improve comfort, mobility, and the likelihood of avoiding back surgery when the treatment is applied to the right candidate. Now, in this video, you're going to learn how to discover how non-surgical spinal decompression works, what it feels like during a treatment session, and how to know if you are a good candidate for this treatment. Stick around to see if whether non-surgical spinal decompression might finally be a realistic option for you, especially if every other treatment you have tried has failed. Hi, I'm Dr. Lam Ly. I'm a chiropractor here in San Jose, California. After more than 20 years in practice, I've seen too many people wait too long to get help or rely on medications just to mask their pain. And they don't even realize how much they're actually missing out on life until it's too late. Now, that's why I created this channel for people living with neck pain, back pain, disc herniations, or even sciatica, who are tired of quick fixes and ready to understand what's really causing their pain. Now, here you're going to get safe, non-surgical, science-based solutions to relieve your pain, protect your spine, and restore your mobility so that you can start living your life again, not just going through it. Subscribe now if you want lasting relief, real results, and the freedom to move without fear. I upload a new video every week. Now, before we get into how non-surgical spinal decompression works, we first need to break down what is actually happening inside a herniated disc. Now, once you see the mechanics, the treatment starts to make a lot more sense. Now, the spinal discs, they sit between each vertebrae, acting as a cushion that absorbs impact and helps you bend, twist, and move. And each disc has a tough outer layer called the annular fibrosis and a softer gel-like material called the nucleus pulposus. Now, when a disc is stressed, overloaded, or worn down over time, tiny tears can happen in the outer layer. Now, as these tears expand, the inner material will begin to push outwards, and this is a disc herniation. And here's the part that most people never hear. The moment the disc becomes injured, the body responds with inflammation. Now, that inflammation alone can cause sharp or aching back pain, stiffness, and even tenderness before the disc ever touches a nerve. But the real trouble starts when the herniation presses on a spinal nerve root. Now, these nerves sit extremely close to the discs. They travel down into the legs and eventually form the sciatic nerve. Now, when the disc pushes into one of those nerve roots, it can irritate and compress it. That is when you get the classic symptoms of severe leg pain, numbness, tingling, burning sensations, and even weakness. Now, it can limit your walking, your sitting, bending, lifting, and disrupt everyday tasks like getting out of bed, getting dressed, or even simply sleeping through the night. So now you know what is really happening when you have a disc herniation. You have a disc that is injured, inflamed, and potentially pressing on a nerve that controls your ability to stand, walk, or even sit without pain. And this brings us to the big question you are probably asking yourself right now. Can anything actually reduce that pressure and calm the nerve down without surgery? Now, that is exactly where non-surgical spinal decompression comes in. So let's break this down in a way that is simple and makes sense. Non-surgical spinal decompression uses a computerized treatment table that gently and gradually pulls and releases the spine in a very controlled cycle. Now, this is not the same as your basic traction. When you do that by yourself at home, by hanging on a bar, maybe with your hands or your ankles. This table, it senses your body's resistance in real time and adjusts the tension so that your muscles do not tighten up or guard. Now that is so important because if the muscles are under tension, you are really stretching your muscles first and not decompressing your spine. The spine cannot separate because the muscles are guarding and protecting the movement, and the disc pressure does not change. Now, when the tension is applied correctly, something very useful happens inside the disc. The vertebrae creates a small, measurable amount of separation. Now, that separation lowers the pressure inside the disc space, and in some cases, the pressure inside the disc can drop so low that it creates a mild negative pressure similar to a vacuum effect. Now, here's why that matters. A lower pressure inside the disc can allow the herniated material to retract slightly or at least take stress off the inflamed tissues around the root. Now, that reduced pressure gives the irritated nerves more room, which can help to decrease the pain, the numbness, and the tingling traveling down your leg. Now, think of it this way. If a disc herniation is constantly putting pressure on a nerve, that nerve stays inflamed and angry. But when decompression lowers the pressure inside the disc, the nerve finally gets a break. And when the nerve gets a break, the body can start to calm the irritation and reduce your symptoms. Now, this doesn't mean magically it'll fix everything in one session, but it does change the mechanics inside the spine in a way that many patients can actually feel over time. So if decompression can change the pressure inside the disc, the next question becomes, what kind of results can someone realistically expect from this treatment? The first benefit most people notice is a gradual reduction in leg pain or sciatic symptoms. When the pressure on the nerve root decreases and the irritation starts to settle, the sharp burning or shooting pain down the legs can begin to calm. Now, for some patients, this happens slowly, and for others, it's surprisingly noticeable within the first few sessions. Now, everybody responds differently, but when the nerve gets relief, people tend to feel it. Now, another benefit is improvement in mobility. When a disc herniation is inflamed and compressed, simple movements like bending forward, getting out of a chair, or even walking for just a few minutes can feel impossible. As the disc pressure decreases and the nerve irritation eases, daily movement often becomes smoother and less guarded. Now, this is why people often report being able to sit longer, stand longer, or even walk farther with less discomfort. And a third benefit is the potential to avoid or delay surgery. Now, this is not a guarantee, but it is a possibility for the right candidate. Now, when nerve inflammation decreases and the pressure reduced, many patients can regain enough function and comfort that surgery becomes less urgent or no longer necessary. Now, this is important because surgery carries risks and recovery time. So having a non-surgical option can reduce symptoms. Now, that's a big deal for many people. Now, non-surgical spinal decompression also supports the spine's natural healing environment. When the pressure inside the disc stays lower through repeated sessions, fluid exchange in the disc can help improve. This may support better nutrition and recovery of the disc over time, especially when paired with stabilization exercises. Now, these benefits will vary from person to person, but the goal is always the same. Reduce the nerve irritation, improve your motion, lessen pain, and give the patient a realistic path to avoid more invasive procedures when possible. Now that you know what the treatment can offer, the next question is just as important. Are there any risks or downsides that you should be aware of? Any treatment that claims to help a disc herniation should also be clear about the risks. Non-surgical spinal decompression is generally well tolerated. It is not as risky as back surgery, but it is not completely free of risk. Now, it is important to understand what can happen. The most common reaction is a mild soreness after the first few sessions. This usually feels similar to, starting a new exercise routine. The spine and the surrounding muscles are being stretched and moved in a way that they are not used to. So some temporary stiffness, achiness can show up. And for most people, this settles within a few days. Now, another possibility is temporary flare-ups of the original symptoms. When pressure changes inside the disc or around a sensitive nerve, that nerve can react before it calms. Now, this does not mean the treatment is harmful, but it can be uncomfortable for a short period. Now, careful monitoring helps make sure that the intensity is adjusted appropriately. Now, rarely some patients experience increased pain that does not settle. Now, this usually is a sign that the disc of the nerve, the roots especially, is too irritated to tolerate decompression forces, and that the condition is not suited for decompression therapy. Now, this is why proper screening is so important and essential before starting care. There are also people who simply do not respond to non-surgical spinal decompression at all. Now, this is not a risk in itself and not harmful in a sense, but it is a realistic limitation. Now, certain types of disc injuries, advanced structural changes, or specific medical conditions may not improve with this method, and it is important to know that up front. The key point is this: when the right patient is selected and the forces controlled properly, non-surgical spinal decompression is considered a safe option with very low risk of serious complications. But understanding the possible downsides is what helps you make an informed decision. Now that you know both the benefits and the risks, the next question naturally becomes, what does the treatment actually feel like? And what can you expect during a session? A typical non-surgical spinal decompression session starts with you lying comfortably on a table, fully clothed. Your hips are secured with a padded harness so the table can apply a gentle, controlled tension through the lower spine. Now, once everything is set, the machine begins a series of slow pull and relax cycles. Most people, they describe the sensation as a gentle stretch through the back and the hips. It is not a sudden or forceful movement at all, and it is gradual, rhythmic, and designed to avoid muscle tightening or guarding. Now, many patients find it surprisingly relaxing, and some even fall asleep during the session. You might feel, a soft pulling sensation where the disc is injured. Now, this can be mild, or you might feel a deeper stretch depending on how irritated the area is. Now, neither response is wrong. Everyone's spine and nerve sensitivity is different. A typical session lasts between 20 and 45 minutes, depending on your condition, the settings chosen, and any other treatments that may be provided during that visit. Afterwards, some people feel looser or lighter, and others, they might have a mild soreness similar to doing new stretches or exercises. Both responses are completely normal and expected after your first session. Now, the key idea is this: a session should feel controlled, comfortable, and predictable. You should never feel sharp pain or a sudden pulling. If you do, the treatment is adjusted or stopped. Comfort matters because relaxed muscles allow the spine to decompress properly. Now that you know what a session feels like, the next question is, how long does a treatment plan take? And when do people usually start noticing improvements? Most treatment plans follow a consistent structure. Non-surgical spinal decompression works best when the pressure inside the disc is lowered repeatedly over time, not just once. Now, this is why sessions are spread out over several weeks. Every person is different with a different disc herniation and associated symptoms, so there is no one-size-fits-all plan of action. However, a common plan is 2 to 3 times a week, ranging from 4 to 12 weeks, with some room for maintenance care at the end. Now, many patients, they begin noticing early changes within the first 4 to 6 sessions. This can show up as reduced leg pain, less back tension and tightness, or a little more confidence on walking, sitting, or bending. Now, these early improvements are often small, but they matter because they signal that the nerve irritation is starting to settle. By the halfway point of a typical plan, improvements in mobility and day-to-day function often become more noticeable. People report being able to sit longer without pain, stand up straighter, or walk farther without the usual symptoms flaring. Now, it's important to understand that results are not the same for everyone. Some people feel progress really quickly, while others notice changes more gradually. Now, the severity of the disc injury, how inflamed the nerve is, and how long you've had these symptoms present all play an important role. A strong treatment plan also includes simple stabilization exercises once the pain begins to calm. Now, these are designed to support the spine, protect the discs, and help maintain the improvements you've gained through spinal decompression. So now that you know the timeline, expectations, the next step is critical. Who should not receive spinal decompression and why? Even though non-surgical spinal decompression can be helpful for many people with disc-related pain, it is not the right treatment for everyone. Now, knowing who should avoid it is just as important as knowing who might benefit. Now, people who have had a recent spinal surgery, especially a fusion with implanted hardware, are generally not good candidates. The forces used during the decompression can place stress on the hardware or fused segments, which can lead to discomfort or complications. Pregnancy, now that's another clear contraindication. The physical changes in the body during pregnancy, along with the position required for the treatment, make decompression unsafe in this stage of life. Individuals with spinal infections, certain spinal tumors, or even cancers that have spread to the spine should avoid decompression. These conditions require medical management, and applying traction-like forces to an unstable or compromised tissue is not recommended. Severe osteoporosis is another situation where decompression is not appropriate. Weak or brittle bones cannot tolerate the tension that is applied during the treatment, even at low settings. Now, there are also people who simply just do not tolerate the treatment well. Now, if someone experiences sharp pain, worsening symptoms, or persistent discomfort during or after sessions, it's a sign that the disc or nerve root may be too irritated or that the decompression is not the right approach for that condition. Now, the goal of screening is simple: identifying the people who can safely benefit and protect the people who cannot. When that is done properly, the treatment is safe, more predictable, and more effective. Now that you know who should and should not receive the treatment, the final step is to understand what to do next. What are the next steps if you think non-surgical spinal decompression might be right for you? This video is not meant to replace the role of your health professional. You still need a proper examination, the right imaging studies, and a clinician who can confirm whether or not non-surgical spinal decompression is appropriate for your specific condition. Now, that said, there are some situations where this treatment becomes a strong possibility. If you have already tried multiple treatments with little to no results, including physical therapy, hot or cold packs, electric muscle stimulation, acupuncture, exercises, or even chiropractic adjustments, you may still be a good candidate for non-surgical spinal decompression, as long as you do not have any contraindications based on your exam and imaging. This therapy can often help people who feel like they have run out of options. If your pain is acute and the disc injury happened within the last 3 months, you may be a good candidate because the disc and the nerve are still in an early phase of irritation. But even if your symptoms have been present for 3 to 6 months, 6 to 12 months, or longer than a year, meaningful improvement is still possible. I've helped many patients in my office who have struggled with chronic disc herniations, persistent back pain, and long-standing leg symptoms that just did not respond to anything else. The next step is simple. Get examined, get the right imaging, and let a qualified provider determine whether non-surgical spinal decompression fits your specific case. When it is the right match, it can become a realistic and effective non-surgical path forward. You should now have a good and thorough understanding of what non-surgical spinal decompression is, how it works, what to expect, and whether it might be an appropriate option for your situation. Now, the goal of this video was to give you clarity and bring in a realistic, evidence-based, informed perspective to the possibility of using non-surgical spinal decompression as a path to recovery. Now remember, do not lose hope. I have seen many patients with long-standing disc injuries, chronic back pain, and stubborn sciatica make meaningful improvements and even a full recovery with non-surgical spinal decompression after every other treatment failed to help them. Now, if you are interested in this therapy, look for a certified non-surgical spinal decompression doctor in your area. If you need help finding one, leave a comment below and I will do my best to point you in the right direction. And if you need more clarification or have additional questions, drop those in the comments as well. I try to read them and I try to respond to everyone as soon as possible. Now, if this video gave you clarity about non-surgical spinal decompression and you found value in the explanation, give it a like and a share. It helps more people understand their options and makes this information easier to find for those who are struggling. Remember to subscribe if you want more non-surgical science-based solutions to help relieve your pain, protect your spine, and restore your mobility so you can start living your life again. And the next video you should watch is this one, 5 daily habits making your disc bulge worse. As you search for a non-surgical spinal decompression doctor, make sure you are not accidentally making your disc worse with one of these 5 habits. Go watch that video next.